I'm Dr. Helen Whitworth, a consultant forensic psychiatrist with over 15 years' experience of working with adults across a range of mental health conditions, including serious mental illnesses such as schizophrenia and bipolar disorder, mood and anxiety disorders, trauma-related diagnoses, personality disorders, and ADHD. ADHD, or Attention Deficit Hyperactivity Disorder, is a recognised and highly treatable medical condition which affects approximately 5% of the population. Historically, the condition has been underdiagnosed, particularly in females. In childhood, boys are more likely to show outwardly hyperactive symptoms, making it easier to identify. Girls, however, often display quieter, inattentive symptoms. They may experience internal restlessness, they may daydream, they may appear careless or disorganised, symptoms and signs which can be overlooked or misunderstood. In adulthood, ADHD symptoms typically become modified. In males, whilst impulsivity often persists, physical hyperactivity may be replaced with inner restlessness and a constantly active mind. Women, meanwhile, often describe mental fatigue and a sense of emotional overwhelm. Both sexes frequently report a lifelong sense of underachievement. Many people with the condition develop masking strategies such as over-preparing and staying up late to catch up. They rely heavily on reminders and may use humour to deflect from their difficulties. ADHD is associated with differences in how certain areas of the brain work, especially those involved in attention, planning, working memory, and emotional regulation. Key regions such as the prefrontal cortex, basal ganglia, and cerebellum may function or connect differently. At a neurochemical level, there are differences in the balance of dopamine and norepinephrine, the neurotransmitters that regulate focus, motivation, alertness, and the ability to sustain effort. These biological differences explain why ADHD manifests as it does and why medical treatments can be so effective. Berkeley Psychiatrists will conduct a comprehensive assessment looking at your lifelong pattern of symptoms to explore whether ADHD is the correct diagnosis. If ADHD is not the cause of your symptoms, psychiatrists can signpost you to appropriate services. Where a diagnosis of ADHD is established, however, evidence-based, highly effective treatments supporting the brain networks involved in attention, planning, and emotional regulation may be considered. Medication helps reduce the internal mental clutter. It improves focus and helps adults to think more clearly and stay on task. By improving dopamine and norepinephrine activity, medication helps sustain motivation rather than coming in bursts. Adults often notice that they can both start and finish tasks more easily. Treatment can reduce irritability, emotional swings, and a sense of being easily overwhelmed. By improving impulse control, adults often notice improvements in decision-making, work performance, and the ability to form and sustain relationships. For many, however, the greatest benefit comes from combining medical treatment with psychological support. Therapy and coaching can help adults develop skills for planning, prioritizing, task initiation, and time management. Untreated ADHD often leads to years of self-criticism, which therapy can address, helping adults understand how the condition impacts friendships, family life, and work. An ADHD diagnosis doesn't just explain the past. More importantly, it opens the door to effective treatments and meaningful change.